The U.S. social safety net is an assortment of programs that protect Americans from poverty and hardship. These programs are supposed to catch individuals if they fall on hard times. Food stamps, housing assistance, Pell Grants are just a few programs that would be considered part of the safety net.
Social supports that a society provides for the people who live in that society. Certainly that gets defined differently around the world, but we could imagine things like universal health care. We could imagine things like universal affordable childcare and access to childcare, accessible childcare.
If you look at the United States compared to other countries, we have a relatively ungenerous system.
From parents staying home to save money on childcare, to friends and family asking help to cover high medical fees or even funeral costs, the pandemic has exposed a broken social safety net.
The reality is that many other countries have robust safety nets, and the US has women instead, in the sense that even long before the pandemic,
in 2018, Jessica Clarko, an associate professor of sociology at Indiana University, started researching new moms.
We asked a bunch of questions about the kind of parenting decisions they wanted to make about things like breastfeeding, co-sleeping, vaccines, screen time, many controversial parenting topics.
Little did she know her research would carry over into the pandemic.
But when the pandemic hit, really, it completely pulled the rug out from under so many of these moms in terms of disrupting their normal routines, their access to support, their resources in many cases. And so we decided that we wanted to pivot a little bit and do some additional surveys and additional interviews to better understand the kinds of challenges that mothers were facing.
The pandemic has shown how damaging a faulty support system could be on families in times of need. The lack of childcare causing families to decide childcare over career.
Essentially, the pandemic came along and ripped a giant hole in what little safety net we really did have in the US. And really, it left women, in many cases, being the ones who are holding together the threads of what's left. Certainly, there are many men who have stepped up in the wake of the pandemic, and many men who were doing a lot before the pandemic as well. But we know from research that the disproportionate share of this labor, this added labor with schools closed, with child care centers closed, with many family members having increased health needs in terms of care and support, essentially this additional labor is disproportionately being done by women. They're oftentimes the ones who, when kind of push comes to shove in family situations, feel like it's their responsibility or that it is more on them to be the ones to step out of the workforce instead of asking their husbands or their partners to do the same.
The ripple effect on all of this has caused strain on personal health and relationships and leaves mothers feeling that they have failed.
Essentially, we find that moms who are in that position, who are trying to fill all those roles simultaneously, they feel like they're failing at all of them. And those feelings of failure and guilt are tremendously debilitating for moms, and especially given that women already tend to earn lower incomes than their male partners, and especially given that women already tend to be in more precarious types of labor situations, either part-time work or work that's more hourly based.
$650 million. That is the number raised per year on the crowdfunding site GoFundMe just for medical bills. Another $330 million are raised on funeral costs alone. Friends and family, even strangers, are pulling together to help cover expenses that many cannot afford.
I think it's very clear that the safety net system in our country is failing when we have families that are turning to each other in many cases for help because the government won't step up to provide them the support that they need.
The number of people who lost medical insurance when they lost their jobs during the pandemic was phenomenal, and really point to the need for having some form of universal health insurance.
This is Dr. Susan Hausman. She is the Vice President and Director of Research at the Upjohn Institute for Employment Research. Lost wages are another trend across crowdfunding sites. Businesses and employees looking for ways to make ends meet.
The federal government provides rules that the states have to comply with, but within those rules, states have a lot of leeway to adjust their program.
So, unemployment programs and qualifications differ from state to state. But as a whole,
we have amongst the lowest wage replacement rates compared to other European countries and Japan. We have a relatively small share of unemployed are eligible to receive benefits. And the length of time that people can receive benefits is low compared to other countries.
Since 1950, the standard for benefits has been 26 weeks. Today, a fifth of the states have cut that down even further.
Some states decided to reduce the number of weeks that people were eligible for benefits. Benefits were not keeping pace with inflation.
For example, Florida and North Carolina rank at the lowest 12 weeks of benefits they will provide for unemployment.
Previously, the record number of people who had applied for benefits in any given week in the United States was between 600,000 and 700,000. We hit millions during the pandemic. Think about a situation where suddenly maybe tens of thousands of people or more are trying to apply for benefits in a given week, and there's only a handful of people to help them.
On March 25th, the Senate voted to pass the CARES Act. This would help fill some of the system's cracks, but those benefits are scheduled to expire at the end of this month, leaving millions at risk of losing unemployment.
Expect that we won't see anything until the new administration comes in. And what we see will very much depend on elections in Georgia.
From self-employed to low wages and even part-time workers, some states have made it challenging to qualify for benefits through the years.
Benefits need to be shored up. That goes hand in hand with more secure financing. And we need to take a close look at increasing the size of this umbrella.
U.S. tends to rank below average on measures of social support among 37 countries. European countries, on the other hand, rank towards the top. That is because Europe's social safety net comes at a cost that is largely paid through taxes on workers and employers. Today, American businesses and millions of people are left in limbo, trying to figure out ways to improve a broken net, while Congress debates another round of stimulus checks. Hey everyone, Cody Broadway here. Thank you so much for taking the time to check out the NBCLX YouTube channel. Be sure to click here for more videos and also click here to subscribe to join the NBCLX community.